Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everybody. Thank you so much for joining The Coalition. I'm your host, Dr. Shani Belgrave. I am a bariatric and minimally invasive surgeon in Atlanta, Georgia. I'm also the founder of Onika Bariatrics and Wellness. You can learn more about me and get connected at www.drshanibelgrave.com. I am excited to welcome to the show today a very special guest. I'm delighted to welcome to the show Dr. Karleena Tuggle, a bariatric and minimally invasive surgeon and also the founder of ProBlk vitamins. Dr. Karleena Tuggle, thank you so much for joining the coalition.
I'm super excited. Thank you for having me.
You are so welcome. Thank you for joining the coalition. Before we get into all the good stuff, I wanted to give you a very special shout out. So Dr. Karleena Tuggle has had a tremendous impact in the field of bariatric surgery here in Atlanta, Georgia. And with my recent launch of Onika Bariatrics and Wellness, I am so excited to bring an expert on the show to talk about weight loss and weight loss surgery. So Dr. Karleena Tuggle, please tell us who you are.
I am Dr. Karleena, and like Shani mentioned, I was doing bariatrics for probably about 15 years, and I fell in love with the transformation of giving people a new lease on life, and that's kind of why I went into that specialty specifically. And then about 6 years ago, my husband and I started ProBlk Health Vitamin Company. And a lot of that was based off of what I was seeing in the clinic and seeing on ER call. You know, the Black community is young in age, but old in disease. And how many times you check the vitamin levels, DB in the toilet, iron is always low, and supplementation is something that a lot of people don't do. And 92% of us are vitamin deficient with no supplementation. So between just the frustrations of just seeing, you know, our people in just general poor health, we thought of something that we can do on the more preventative side because we're always reactive. But what is something we can do to try to maintain or prevent a lot of these chronic illnesses? So that's how the company came to be. And up to 50% of the net profits go towards initiatives that focus on eradicating healthcare disparities. So it's more than a vitamin company, it's a movement. And really, we want an investment in your individual health to be an investment for the good of the group, because it's about all of us getting together and being stronger so that we can improve our outcomes, live longer, you know, and leave a legacy that's better than how we received it.
That is a wonderful mission. How can you provide some insight? Because the name is ProBlk Health, and I follow you on social media. How do you explain to people that it's not anti any one group, but rather addressing health inequities and disparities in healthcare?
Oh, I love that question. It's literally, if you take it for what it is, it's promoting the good health in the Black community. It's not about anti anybody. It's just about, we have to understand what the facts are. The facts are that our health is suboptimal. We have minimal resources to do anything about it. And this is a historical and social structural issue that has been going on for, let's say, 400 years. So this is about, do you care about maintaining the Black community? Anyone can take these vitamins. These are not made specifically for Black people. But it's about just illuminating light and increasing the health consciousness in our community, not only within ourselves, but hopefully other people as well, to want to support that mission and want to increase our survivability as well.
Beautiful work that you are doing. So when we talk about bariatric surgery, what do you wish more people understood about obesity, especially as they're considering surgery?
I wish more people understood that obesity is a chronic disease. And even if you have surgery, and can lose the weight, it's something that you will battle probably every day for the rest of your life. You're not really cured. You're improved, but you still have to maintain and follow a healthy lifestyle. You still have to watch what you eat. You still have to be more active. You still have to get more sleep. So it's not an easy way out. And I think a lot of people, for a number of reasons that we can get into on another conversation, but they think it's the easy way out. And why don't you just change your lifestyle, or why don't you just eat less? If it was so simple, why wouldn't we do that? You know, like, why would GLP-1s be such the craze if it was just as easy as eat better and move more? So I wish that people understood that, yes, a lot of it is due to your individual choices, but there comes a point where you may need more assistance than just changing your eating habits or just exercising more, because you're at a point where you're going to get diminished returns in making those changes.
Well, that's really good insight. What you have said, I have heard. People feel that they're going to be ridiculed for taking an easy way out. And going through bariatric surgery is never the easy way out. As you've stated, there are lifelong things that you have to do to maintain your result. And so that's part of why I like doing the podcast, is to try to see if we can't shift the culture, remove stigma, because those things that are echoed in communities all across the country are things that we're battling with, getting people to feel comfortable and confident making good decisions for their health, because we know that bariatric surgery is the most definitive and durable treatment for obesity. So that's the perfect segue to my next question, which is, and this is something a lot of people ask all the time, well, how do I know when it's time to consider surgery? A lot of times people think of surgery as kind of a last resort. And I always tell people, it doesn't have to be. It's an amazing tool. So in your opinion, when should people think about weight loss surgery?
I think you should think about weight loss surgery once. Okay, there's a couple things. One is recognizing that your weight is negatively impacting your health. So the recognition says, okay, I need to do something. And it may not be surgery right away, but something has to change. And surgery is an option, but you're like, okay, I got to do something about this. Then you have to be committed to that change, because this is not something that you just put one toe in and think that everything is going to work out. It is a commitment. And if you are not ready to do these healthy habits on a regular basis, because of your motivation, your discipline, realistically, what your resources are. If you are not ready to do that, then surgery is not ready for you. Like you need to be at a point in your life where you can maintain and support, where it's the maintenance. If you buy a new car, you want to make sure you're getting the oil checked, I guess once a year. I don't know. My husband takes care of that. But, there's things that you do to maintain your investment. If your weight is interfering with your life and or contributing to your high blood pressure and your diabetes, and you're 35 years old and you have bone-on-bone arthritis in both of your knees, and you're on 3 blood pressure medications and 2 diabetes medications, then you have sleep apnea. Like, what kind of life, what quality of life is that really, in terms of like the long-term goal? I'm not saying it's a bad life, but we need to think bigger and longer than right now. Like, where do you see yourself in 5, 10, 15 years? And do you think that if you keep doing what you're doing now, you're going to be alive and or healthy in that time?
Yeah, I think those are all really great points. Many insurance carriers will cover bariatric surgery for a body mass index of 40 or greater. And BMI, or body mass index, as you know, is a number derived from your height and weight, with obesity starting at 30. So for people watching that are trying to figure out, is this something for me? If you have a BMI of 40 or greater, many insurance carriers will cover it. Or if you have a body mass index of 35 or greater, with one or more of the weight-related conditions that you just mentioned: high blood pressure, diabetes, sleep apnea. And interestingly, I'm starting to see now that more and more carriers are moving to cover surgery at lower BMIs, some 30 to 35 with or without comorbidities. And I think that's great because it's speaking to the fact that excess fat is the fat cells are active. They cause inflammation in the body. And so why wait until someone has severe obesity when we know that obesity in general is putting their health at risk? So thank you so much for that insight. This next topic is one of my favorite things to talk about. We recently did an episode on it, mindset. And we kind of hinted a little bit about mindset a few minutes ago, but what would be your key things that you think people should know about mindset before undergoing bariatric surgery?
I think one thing in the mindset is you can't rely on it to fix all of your problems without you doing your part. And it goes back to the magic bullet theory that is incredibly incorrect. You have to be in the mindset of you are going to put in some work, and you're going to put in a lot of work, and you're going to keep putting in a lot of work. If you stress eat, the same triggers, like there's so many things that go into disorderly or destructive eating. So being in the mindset to potentially significantly change how you interact with food, how you interact with your family and your friends, where you decide to go, how you decide to spend your time, your life will be different because you're going to be expecting different results. But you have to be ready to give up some things to gain some things. You're losing weight, but what do you gain when you lose the weight? Freedom and longevity and all these things, but you're not going to be the same person.
That's fascinating because some people will say, well, if I have to do all of that, then what is the point of surgery? Because I have an issue with sticking to certain things. I'm having issues with cravings. And so if all of that is still going to be there, what is the point of surgery? And I think it's interesting because, as you mentioned earlier, obesity is a chronic disease, but we know that it's not a matter of willpower. There's so many factors at play with obesity, some of it genetic, some of it environmental. And so while mindset does play a role, it's not the only thing that plays a role. So when people are kind of like, well, if that's the point, if that's the case, why bother? And it's like, no, because it's still very effective. It still works. It's a tool, but you have to be willing to use your tool. You have to be willing to use your tool. Yeah.
And there's nothing to be ashamed or embarrassed about that. Some people need more help than others. I mean, that's just life. And that's in a lot of different areas in life, not just weight. So I don't think it's anything to be embarrassed or ashamed about to benefit from assistance. At a certain point in your life, the surgery may be the pivotal point to get you over that hump to really see significant weight loss. I'm sure you've seen the whole yo-yo diet thing. Oh, I can lose a good 5 to 10, but how long are you going to be on that crazy crash diet that isn't, one, healthy or two, sustainable before you go back to what you really want, and then you gain more weight than you lost? So it's just important to remember that, in addition to all of the genetic factors and the metabolic factors that go into it. But you can only control the things that you can control. You can control your habits. You can't control your genetics. You can't control other stuff that's going on. But how do you not contribute to the problem?
That is perfect. Controlling what you can, because you cannot change your genetics. But there are certain things that you can control. And so I love that. It's all about empowerment, so that you take this tool and you really use it to the fullest. So the other thing I was going to ask you about is, what are some emotional or relational changes that people may not anticipate, but that you've seen in your experience that they have after massive weight loss?
I have seen a lot of relationships, like marriages or boyfriend, girlfriend, separations and divorces. I've seen friend circles dissolve or weaken. I've seen addictive habits increase. And this is not like everyone, but it happens more often than you think. And I think there's a number of reasons for that. I think a lot of what we do, yes, we are a physical specialty, but a lot of what we do is psychological. And a lot of people, I think, are in codependent relationships. A lot of people, I think, based on their weight and or their trauma, have mental health challenges with anxiety and depression, and they don't or may not feel worthy to be out in the world or the streets or put themselves out there. And then they lose weight and they feel good and they're comfortable, and their partner, who's used to them being at home all the time, is all like, whoa, 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 where are we going? And that person has their insecurities, but they were so used to being able to control that person, they were more comfortable with that person at that weight. And I've seen a lot of friction when one person's empowered and the other person is not used to that dynamic shift. And what do you do about that? Or a friend group, I want to have the surgery, but my friends are like, no, girl, don't do it, or it's dangerous, or what have you. And a lot of times they're scared and they want to keep you exactly where they are, because birds of a feather flock together. But you can't bring everybody with you at the consultation. If at all possible, have your family and friends on board with you, because you will need support. And very few things drive me more crazy than your immediate circle who understand what you're trying to do and yet do not change their ways, which is their right, but it's almost like you're setting up the person that you claim to love. Like, I've had people, it's post-op day 1, and my brother, my husband, my sister has Popeyes and they're eating it in front of, why? Like, this is already a setup. It just doesn't make sense. And really getting not necessarily the buy-in, but having those frank conversations, like, my life will change in these ways. Can you help me change? If you want to keep doing what you're doing, do you mind not doing it so obviously, or bringing it into the house, or, like, I don't need these extra temptations. So you need that support. And when people are not supportive and they are in your face all the time, it is extra challenging to maintain on that path that we're trying to foster and encourage.
Wow. That was deep. It made me wonder if some of those situations that people are experiencing, if maybe when they've lost weight and they've improved their health, they're actually becoming who they were always, who they really were all along. And now it's not causing a relationship problem, but rather revealing one, if that makes sense.
That does. That does. There's been a problem, but we were just sweeping it under rugs.
Well, Dr. Karleena Tuggle, this has been an amazing conversation. For people that want to learn more about you and get connected, what is the best way for people to reach out to you?
So the best way is our website is ProBlkHealth.com, ProBlk Health.com. We are on Instagram, Facebook, and TikTok. And I love to hear people's stories. Everybody has a different health story and what is important to them. So Darian, my husband, and I, we do events in the community. We like to educate, but we just want to make health more inclusive and interesting and fun to get more people on board.
Fantastic. Well, thank you so much, Dr. Karleena Tuggle. You have an open invitation to join the coalition anytime. Well, everybody, thank you so much for tuning in to another impactful episode of the Coalition. I'm your host, Dr. Shani Belgrave. I am also the founder of Onika Bariatrics and Wellness. You can learn more about me and get connected at www.drshanibelgrave.com. Very special thank you to Dr. Karleena Tuggle, bariatric and minimally invasive surgeon and founder of ProBlk Health Vitamins. You can learn more about Dr. Tuggle and get connected with her on her website. Thanks everybody for watching. Make sure you share this episode with friends and family to raise awareness about bariatric surgery and weight loss. Thanks for watching, you guys. I'll see you next time.